Um, I I did want to point out that Sue is not here because she's getting a mammogram and ultrasound today. So good vibes to her.
I read that.
She posted it.
Yeah, she did post it.
Okay. On her
On
public
Facebook.
page.
Who's having it, Sue?
Wait, I think we're all friends. Melissa, you know Sue, right?
Yeah. Yeah.
Okay.
On her ticket to.
Okay.
Yeah.
I just told the girls here that I already got an email from somebody that said, I hate it when people say that cancer isn't a gift. I think cancer can be a gift and you can find something good out of cancer. It can give you something good or something like that. I'm like, I think you missed the point.
Yeah, it's a present I don't want. Thank you very much. But yes, it brought us this. Right?
Okay.
I'd like to re-gift it to a few miserable people.
That's my point. Like, it's not.
Can you return it?
Can I return it?
Can I just get store credit and get, like, I don't know.
Definitely. Yeah.
But to say it's a gift, when you think of a gift, what do you think of?
A gift.
Something that brings you joy.
Something that you want and you're happy that you have.
Yes, absolutely.
This is not.
No,
This
it's
doesn't
not.
make me happy. This doesn't make me happy at all.
Not at all.
No.
No.
No gift.
So how can? I mean, I agree with what Seporah said. You can, from this, we got friendships and, bonds that I don't think cancer can break, but it's not because of cancer. I hate giving cancer the authority for anything. And
it's not giving yourself enough credit for being able to find the positive things in a crappy situation.
Well, that's exactly what it is, Seporah. I totally agree. It's like, so you're given these cards, and you can either make the best of it, or you can just let it get the worst of you, but so you try to make the best of it.
I had to give this speech once, and this lady was a real bitch to me, and she had cancer too. And after she really totally jarred me and like sent me. It was bad. She was really nasty to me. And afterwards, a friend of mine looked at me and goes, "Look she was a bitch before cancer, and she was a bitch after cancer. Cancer's not going to change that."
People think that cancer changes you. It makes you like if you're not a nice person before, there's no like you're probably even going to be even worse after.
Don't you think?
Because in my experience, from people that I've known that have big ass bitches, they are bigger ass bitches now.
I don't know how cancer can make you a better person when you think of all the shit that you pile on top of you. Well, Lisa, look at that face.
No, I don't think it makes you a better person at all. I think it makes you maybe rearrange your priorities, get the crap out of your life. You realize who's adding to your life and who's not.
But I don't think that it can do that to everybody. I think some people...
It's getting your priorities right. Some people, their priorities are themselves. And if that's how you are as a person, having cancer is just going to emphasize that or justify it for you. And
Right through the roof. I totally agree. Yep.
Tom joked around that I didn't have a filter button before cancer, and my filter button broke the fuck off.
That's what my friend said.
It's like it was gone. People would say shit to me, and I would literally just like rip them apart in the middle of the grocery store.
Yeah, I've never been good at holding back. I'm a New York.
Walk away.
I see a lot of people talking about, staying positive through this whole, thing, and I think that's kind of an aspect of the gift. Just if you think good things about it, you'll do okay, or you'll heal faster if you have more.
This all the time.
Oh my God, that drives me crazy.
So Seporah, that's your problem, You're not positive enough. That's why you still got cancer.
I know. I'm such a.
That's why you got a tumor.
I got a tumor.
I think you're funny. I think you were probably funny before cancer too.
If someone gives you a gift you don't like, staring at it and thinking positively isn't going to change it into something that you do like. So the fact that cancer is not a gift and that thinking positive can't make it go away. Positive thinking and happy thoughts and rainbows and unicorns, Skittles, And if all that could cure cancer, there would be no cancer. That's just not how it works.
Because no positive person has ever died from cancer.
Right. We all brought it on ourselves because of the negative aura we put out.
You know what, though?
Cancer, it's totally our fault.
But here's my but with that comment.
Here's
And I got a big old but. At my support group one week, I had one of the girls text me, and she said, I don't think I'm going to come. I'm way too negative this week. I'm really down. And we have a new girl coming, and I think she needs more positive, and that's not me. And I ended up calling her, and I said, look, you got to come, because what you don't see is that, yeah, maybe you're down and maybe you're negative, but she may also need to see that, because she may need to see that your negative is normal and that feeling needs to be validated.
Well,
What you just said, Melissa, is that you see so much positive, and you got it, girl. Go beat 'em and fight like a girl, and you see all that great shit, but at home you're sobbing and you're crying and you're like, shit, why don't I have that get up and go attitude? And you think there's something wrong with you. Exactly. You think, why don't I think cancer's a gift?
Well, we've talked about this, about all the articles and stuff they put out there are all about, it's all positive stories about how, oh, so-and-so had breast cancer, but now they climbed a mountain, and now they did this, and now they thought they couldn't have kids, and now they have 3 kids, and all this stuff. Those are the stories that get published, and those are the stories that make their way around.
To see the bad stuff or hear the bad stuff.
And there's nothing wrong with us for experiencing the part of it and the bad part of it and feeling the bad part of it, but everybody just wants to see the happy.
They do. They do.
I think if maybe we talked about the bad stuff a little bit more, maybe the post-traumatic stress and the depression that follows breast cancer might actually go down a little bit, because then we'd be talking about it and we'd be seeing that it is affecting other people and that it's real.
Well, like, if people ask me how I'm feeling, if I say anything other than fine or good, they kind of get this look like, oh, what do you mean you're not feeling good? Like there's something totally wrong about
the good old fine.
Right.
You're fine.
I feel great. And well, you look good, so you must be feeling good. And part of me just wants to be like, I just spent the last hour on the toilet, and I'm probably going to go right back there, and I haven't eaten in 3 days, so I don't know what's coming out of me. And, like, all these things that I want to say, and you can't, because nobody wants to hear it.
We want to hear it. Tell it to us.
But you want to know it. The people that should be listening are the ones that are, turning what's the phrase? Like, they don't want to hear it.
Turning a deaf ear.
Yeah. It's showing what's true. Like, I know this young woman, who her blogs about breast cancer are nothing but, like you said, butterflies and unicorns. Right. And I sit there and I go, I'm a positive person, but everybody has bad days and bad times. Mm-hmm. And how does this make other people who are fighting it read this and go, God, why am I not always so happy? And
what am I doing wrong? This is my fault. And what did I do to make this such a negative situation? And that's not true. They didn't do anything.
No, and it's just not
I think it's so important to talk about the negative because of exactly what we're saying right now.
It's harmful not to. It's,
I think it is too. I mean, obviously, it feels better when you're being positive, and you don't want to be all down in the dumps, but it's just not realistic, I don't think.
Well, I think at least I'm pretty sure I showed you, but I know I definitely showed you. I showed Lisa and Seporah, but Melissa, this person. The other day, I had put a post up about my metastatic friends. I said, it's cold and flu season. Make sure you put your mask on. It was a jokey post I put because you don't know what those sickly freaks you're gonna catch, and I put a smiley face with it. And somebody actually wrote underneath it, I have to leave this site. Your negativity is unreal, and I can only be on pages where it's positive and you lift people up.
You're very depressing to me.
I actually, I was not really familiar with a group that I happened upon, and I said something in response to a comment about stage 4 diagnosis, and it was very, very esoteric. It was like this closed circle, and I said, I don't think we should make it a metastatic versus non-metastatic conversation. I think we all have the potential to end up there, and nobody wants to be there. And after saying that, somebody responded to me and said, basically that I had no clue what I was talking about, and that they wanted to deck me. If they had been like in physical, the same physical space as me, they would have punched me in the face. And I just, I think there are some circles of people that.
Wait, they actually said I'd punch you in the face?
Oh yeah, they were.
Because you said that we all have the potential to be metastatic?
Right.
That's what 1 in 3 means.
I think we should make it, like stage 4 versus non-stage 4. It should be all inclusive. And it was just in this particular conversation, and I was really shocked and surprised because really, I mean, who can we be here for if we're not here for each other? And I don't know. I just don't live in that world. I live in the world where we're all struggling. We're all, trying to beat the odds. We're all trying to deal with the
real world
and that was dealt to us.
The problem is that everyone lives in that world, but that group of people, they want to live somewhere else. They want to go live where everything is okay, and they can't accept that. They just can't accept the reality in front of them, and it's very frustrating.
That is very sad. And, I have a couple thoughts on that, though. I do think the metastatic world is in a subcategory because there's such
little focus on it
and such few focus on them. I think that is part of the problem, and I feel like that door needs to be opened up. And I agree with you in the respect that it needs to be opened up wide, and we need to be bringing all of the categories into one room, because how are we going to get anywhere if we don't talk about it all? I mean, we're not going to get anywhere.
I'm always curious. I'm curious to hear from those people that didn't want to hear about, the fact that metastatic cancer can affect anyone, that the cancer can come back, and then hear from those people where it actually did come back, and then how do they feel now? And, would they go back and still say all the things that they said? Mm-hmm. Would they admit that they were wrong? Or, I'm curious about that. All these people that are so adamant that, you're just being negative when you say that everyone has the potential to have stage 4 and that this and, that, but what happens when it actually does happen to them?
Right. I also think, regarding the idea of cancer being a gift is and being positive, is that I think we're often set up by our medical teams I remember my doctors in particular saying, you're going to have one hell of a year. But
exactly what my doctor said to me.
But I thought, okay, a year. But after that year, I'll be feeling good, and I'll be feeling better, and maybe I won't be dealing with the pain and the struggle. And that's such a lie. That's such a, it's a misguided bit of information that cancer patients hang on to. They're looking forward to.
Your doctors, did any of them have breast cancer?
No.
I think that's part of it.
Yeah.
How do they frickin' know?
Well, I think they look at it in terms of treatment. You're going to have a bad year because you have to have surgery, then you have to have chemo, then you have to have radiation, and then you're done.
Right.
So that's all they deal with. They don't deal with the after stuff. Taking just the aromatase inhibitors. My oncologist, I think, was shocked at how crappy they made me feel. Mm-hmm. In comparison, you just think, oh, chemo's the worst, radiation, chemo, whatever. But it's it's so much longer than that. It goes on so much longer than that.
When you first start treatment, each step kind of has an end date for the most part. I had chemo for 5 months. After 5 months, then I had my surgery. Then after my surgery, I had 33 rounds of radiation, and then that was it. Now, I'm on the oral chemo, I'm on the aromatase inhibitor for who knows how long. There's
Right.
and with chemo, you start to feel better. You find it's like the pattern, like after 10 days, you start to feel a little bit better, and then you feel really good just in time for your next round. But now, being on these pills every day, like, I have no idea how I'm going to feel from Monday to the next. There's no day where I'm like, okay, I'll feel better by next Tuesday, and then we can do whatever. Next Tuesday I might be, like, under the bed, like, crying, But, like, there's no end in sight, and people don't realize that.
No end in sight.
Well, I just was talking about, because Lisa, I actually was thinking about you when I was talking about today, breast mobilization and breast massages, and wondered how many people do it, and I was shocked how many people were never told.
Don't even know about it.
When I would go to my plastic surgeon, she would stand there and she would just massage it, and she would just be like, yeah. She has a very, like, soothing voice, and she would just be standing there massaging my breast, and she would just be like, when you're at home, let's do this. Great. Let's do this. It's with the other one, too. Focus on this one. Do this one a little bit more. And I just be like, okay, this is great, thanks.
AnneMarie,
did your breast doctor tell you to mobilize or massage your breast and the scars?
Who?
Melissa.
Mine did. Yeah, they did inform me to do that, and I did do it. I did. I bought like one of the bio oils and used that for my scars and pretty regularly massaged the scars especially. But we're all so different too. I mean.
No, I know, but if you go and look on the Facebook page, almost every single person was never told to do it, ever.
Really?
Yeah, they're all like, I was never told this. This is new. Thank you so much for letting me know. They never told.
Do you think that's the reason for a lot of, like, the contractures that happen?
I think it's what the heck's that?
That was my phone, sorry.
Oh, I think it's the result of added pain, scar tissue buildup. I mean, the fat neurosis that builds up. I mean, all of that is a result of people not massaging and taking care of their breasts.
Is that why cording happens?
Well, cording is when your lymph nodes are removed and your auxiliary kind of twists. I guess it's the easiest way for me to describe it, don't you think, Lisa?
Yeah, anything can sort of get that going. Any sort of, backup in the lymph system from any, like, infection or, anything that aggravates the system. For me, yeah. I got it badly when my implant got infected, and then I got really bad cording. But for you, AnneMarie, it's like you don't even know, right?
I have no, I mean, so the last surgery was almost 8 weeks ago. He popped the cord in that surgery, and you felt the cord the other day. I already have formed cords again, and there's no infection on this hand. I mean, I've had this migraine for a couple of weeks now, but a migraine's not going to give you a cord.
Maybe it's still from just the trauma from the surgery. And
I wonder. I mean, I see the breast care doctor. The problem is that the cord starts in my breast, and for them to pop it is very, very difficult to do because it's different when it's in your arm to pop it. To get in there and really pop that cord is difficult. I'll see what she does tomorrow, and it freaking hurts when they pop it.
Oh, yeah. Plus, a lot of people don't even really know that much about lymphatics, really.
No, they do not. And honestly, like, thank God my plastic surgeon knows what he's talking about, because at first I kept saying, when I first had the cording, I was like, I can't lift my arm up. It was right after my surgery. And he'd look at me and he'd shake his head and he'd say, you just had surgery. Of course you can. And then I had a tank top on, and I was like, Tony, I could only lift my arm to here. And he like looked at me like this. He's like, you got frickin' cording, like, because he could see it, but I had a tank top on. I didn't know what cording was. I had never heard of it, and I think that's huge in what we are discussing right now, because there's so much out there that the doctors do not say to you. look for pain in your arm that feels like tugging, that feels like, this could be a sign of da-da. And I feel like they don't tell you because they think that we're going to get it in our head, and then we're going to be like, oh my God, I think I got cording, when you don't really have it. But I think in actuality what they end up doing is freaking us out, because I was scared. I was like, God, what happened to my arm? I can't use my arm anymore. I couldn't lift a pen up. I could not lift a pen up. So I think it actually is doing the opposite of what I think doctors are trying to do. I really do. Just like Dumbbutt over there with her shingles. She had the shingles. She goes to the doctor and, says, what's this? And they say, oh, it could be shingles, but by Thursday it develops into shingles. Like, they should have done something ASAP about it. Hi.
That's a no-brainer to me. The shingles thing, but whatever.
Right? Don't you feel like that sometimes?
Like what?
Like they don't really listen to what we're saying.
Yeah, I think they just. I don't know. Maybe it's partly that they want everything to be okay, so they are trying to guard themselves from.
Oh, that's an interesting thought.
But maybe they just some stories I've heard from people, like their doctors just don't seem to want to take the time to help them, which is really sad.
I think it's a whole mixture of things. It's amazing to me, like the things that were covered and told by me, or by my doctors to me, and then the things that they missed also, that other people, their doctors covered.
Like, oh, sorry.
No, that's all right. Just like, something as simple as AnneMarie, I think we talked about this with post-op. Why do plastic surgeons not tell their patients ahead of time what bra they need to wear after surgery? Why do people not know that? Like, you're going to need a bra, you're not going to need a bra, this is what you should be wearing, you're going to be wrapped, you're not going to be wrapped, you're whatever.
You see, mine was really good. They covered everything. They had me in the bra from the get-go. They told me what I needed. They got me everything. So, yeah, other women are like, wait, you had a bra after? Like, wait, so you did this after? I don't think I did that. Like, yeah, it's...
I agree with you, but Lisa's right, and then most people even go as far as, like, with the drains, they hand you a picture that is like a caricature. Here, this is what you're going to have. And I'm like, what the hell is this? I'm going to have it where? Like, what do you mean? Like, they're like, oh, they'll explain it to you when you get out of surgery. Out of surgery? Like, tell it to me now. I don't,
Right.
I prepare.
I didn't realize that I'm sorry. Sorry, this is no, I had the tram flap reconstruction, and I didn't realize that I was going to have two drains in, where the sun don't shine.
Yeah.
That they would be as painful as they were. I wasn't prepared for that. I knew about the drains on the side, but I had 6 drains altogether, plus the pain ball. I had like an alien with all these tentacles walking around naked because nothing that I could put on could bear the weight of the drains. And no one told me.
Yep.
I think that a lot of us discover, like, along the way, after a lot of things are done, that when we go back for follow-ups and continued care, we actually start realizing, like, we know way more sometimes than what our providers are telling us or what they're doing for us. I think part of that's because we're so connected to each other and we share so many stories and we know what's happening with everyone. But, I mean, I went to get my flu shot this year, and I don't even think she was a nurse, maybe like the medical assistant came in and gave it to me, and I said, I can't have one on my right side. That's my bad side, no blood pressure, nothing. And she said, oh, it'll be fine because you're having 2 shots. We have to do one on each side. And I was really reluctant, but I felt like, here's a medical person, and I'm telling her no, but she's telling me it's going to be fine. And I got really small, and I said, okay, and I let her do it. And then I went home, and everybody told me, no, there's no way you should have let her do that. And so those are examples of, like, people not knowing how to care for patients who have been through stuff like this. And, when you go back to your primary care doctor after seeing all these specialists, it's almost like, well, I mean, Seporah, you're probably, like, more in touch with your regular doctors all the time.
Well, I don't have a primary care doctor, so.
Well, you're specialists all the time.
I'm there at least once a month, so there's kind of need, really.
She got a whole litany of doctors.
I do.
Right. So
Got
when you
doctors
go back
coming out
to-
her butt.
But well, like 2 weeks ago, I had to have one of my toenails surgically removed. It's just what they do during chemo. It's the 4th time it's happened. And so I go to the doctor, and this nurse comes in. You could just tell, like, she just had an attitude just by the way she looked. Like, it wasn't just, like, bitchy resting face. She was, like, flat out bitch. She went to take my blood pressure, and I have lymphedema in my left arm.
And bad. Like, she's got bad lymphedema.
And I have a blocked lymph node in my right arm that is causing symptoms, so they told me don't do anything with the right arm yet, until we have everything figured out, whatever. And so she went to take my blood pressure, and my friend was there, and she jumped, and she was like, no, she can't have it done on her right arm. And the nurse, like, had this look on her face, like, one of those, like, she looked down, and she was like, you gotta be kidding me. Like, looks on her face. And she's like, look, I don't know, I don't care what you want, but I do this all the time. It's gonna be, fine. And she, like, threw a little hissy fit. We actually kicked her out of the room and had the doctor get another nurse to come in.
Yeah.
She just had such an attitude about it. Just about, like,
If you had to get your blood pressure taken like that, your lymphedema would have definitely, without a doubt, flared up.
The last time I had pressure taken from my right arm, it did. My whole arm swelled up. I had nerve pain for like 12 hours after that. So I'm like, and my friend was like, she was standing up for me, and she was like, it's not a question of want. She can't have it. And it turns out this nurse, she's like, well, I was diagnosed with breast cancer in 2003. We're like, good for you. But, you clearly don't have lymphedema, or if you do, it's under control. But either way, if you are a medical professional, you should know these things, or maybe you should have enough, sense to
Sensitivities?
the patient. To what?
Some sensitivity to listen to you. That you
Yeah.
Well, sensitivity. I'm going to play devil's advocate just for a second because.
Oh, God, here we go.
Well, I am because I'm a nurse, and accidentally many times with patients that came into the ER, I didn't know that they couldn't have blood pressures or blood drawn.
But if someone tells you, wouldn't you be like, okay, why?
Absolutely. But I mean, I have accidentally done it, and the patients have been fine, so it doesn't happen all the time. The other thing is my physical therapist, who's like the lymphedema queen, is saying that now they're saying that you can have things done, like you can have blood drawn, with.
They've been taking blood pressure from my wrist, and then when I was in the ER, they got a vein in my wrist. So she said as long as they're staying below the elbow, it's okay.
And I think there's exceptions to every rule.
Yeah.
I mean, you could be the one that 10 out of whatever that it's going to flare up, but you're right. The lack of the insensitivity of just saying, "Oh, you're going to be fine."
These patients, we need to be responsible for ourselves and speak up and say, "Don't do that because I have this." But yeah, then the nurses, and the other medical professionals need to be able to, say, come down from their pedestals and say, "Oh, okay. Well, what can we do? How can we work together to make this, easier for us all?" And there's
always a better way than saying.
I think the other aspect to that is a risk of infection because, I bruise very easily when I get a blood drawn. And what if I had blood drawn out of that arm, had a bruise, and then got an infection from it? You've seen my finger when I've gotten a hangnail. You know what I mean?
Totally get that.
I want to go back to what you're saying about practitioners. When I had an MRI a couple months ago, it was before my cording was horrible in this arm. Horrible. You could feel like 7 of them.
Right.
You can't do anything in this arm. I had a horrible lymphedema flare-up. My arm was killing me.
And you only had how many lymph nodes taken out on both sides?
8 in one and 6 in the other. That's it.
Well, that's still a lot, though.
Well, whatever. And then he took 2 more out of this side with a deep.
Okay.
Because they were juicy. So he went to go put the contrast in my left arm, and I said, I have cording in this arm. You're going to have a very difficult time getting it in. Are you experienced with this? And he looked at me and he's like, yeah, I've put this in before. That's what he said to me. And I had my girlfriend MC with me, and I said, I understand you've put contrast in before, but have you experienced it with cording? It's different. You know, it's going to hurt me, and it's hard to get the line in. Well, he tried like 3 times. He's like, there's something in there.
Right, he had no clue.
Now, as I get that he doesn't know what cording is because it's not something normal.
Right.
As a medical professional, if someone came to you and said, I have cording in my arm, and you didn't know what it was, what would you have done?
You find out.
Yeah. Like, get off your ass and go freaking Google it.
Or ask another.
And then maybe you would have known what it was.
Ask another nurse and say, have you ever drawn blood from someone that has had cording? And
or I'm laughing at you because you look like an angel with the light.
I know. Like,
you're an angel. Yes. Go ahead. I'm sorry.
Which actually brings me. I wanted to talk about caregivers a little bit because of dipshit over there, and she gets a little feisty when her mom comes to visit and tries to take care of her.
Am I the dipshit?
Yeah, I was wondering who dipshit was.
I know, it could be anyone, really.
Well, I mean, I'm friends with Melissa, but I don't know if I can call her dipshit yet.
It's a term of endearment from AnneMarie, so you should feel honored to be called a dipshit.
So, caregiving is quite difficult. And I think that it's our job now, since you don't require much caregiving, except when your mom comes to visit, and us sitting here don't require much of any, is to really enlighten others how they can help people when those that they love need that assistance. Do you know what I'm saying? Because...
Well, one of the reasons that my mom and I argue a lot is because I know she has all those mom feelings. She feels guilty. She wants to do something. She doesn't want to see me in pain. She wants to do whatever she can to make this easier for me. But instead of saying, what can I do, she goes and does what she thinks I need her to do. And it's 99% of the time. I was going
to say that.
Yeah, it's 99% of the time something that not only is not helpful, but it pisses me off. So then we end up getting to a fight, and it's just like, yeah.
But that Seporah is 100% of what usually happens. Yeah. How many times when you guys are going through everything did someone say, what can I do to help? And then they end up like doing something asinine, and you're like, well, that didn't fucking help me at all.
Well, I had before my surgery, before my double mastectomy, one of my friends came over, and she was like, how about I clean your apartment? And at that time, I was like, that's great, because I had just gone through chemo. I was tired. I couldn't, wash the floors. I couldn't do anything. And I thought that's what she meant, that she was just going to do, like, dusting and all that. She ended up rearranging pretty much everything in my apartment, even though I told her, I'm going into my surgery. I need things at waist level because I'm not going to be able to reach or bend for a while. And she put everything that I could possibly need so far out of reach. And then she got mad when I told her. She was like, I just spent 4 hours cleaning your apartment, and you don't appreciate it at all. And I'm like, in that sense, it's not helpful at all, because then my mom came out, and she had to undo everything, because then by that time, I couldn't do anything, because of my surgery.
So what can they do? What can they do to help us? Like, what can they do to help other people?
Ask what
really help.
Ask what they need and have a few suggestions. Like, what can I do for you? And if they say nothing, because some people just have a lot of pride and don't want to accept help, so say, can I pick you?
I don't know who that would be.
I go pick up your medication.
Oh, my husband.
Oh, that's a good one. Seporah, that's a good one.
What?
That's a good one. Pick up your medication.
Yeah, my friends have done that, because sometimes, especially if it's like an antibiotic when I'm not feeling well, I don't want to go out, and they can go and pick it up for me. That's so helpful. That's one of the most helpful things they could do, so I don't have to move.
I love that one.
Me too.
But see, it's different for Seporah because she's single and living by herself.
Thanks for rubbing it in.
No, listen, my husband was the biggest pain in the ass when I was sick. He didn't let anybody do anything, and it drove me crazy. It literally drove me crazy.
Like he wanted to do it all?
He wanted to do it all. He didn't let people pick up our kids. He didn't want people to cook for us. He turned down, God forbid someone bring a pie because it's sugar and that feeds cancer. He was a pain in the ass. Seriously.
Not letting a pie is, I think, grounds for divorce right there.
I mean, it was like, where is the pie? The pies just kept coming. He's like, get rid of the pies. So, but I mean, I think it's different. I think if you're specific, like you said, Seporah, you can help me by, it'd be so great if you would do this. It would be so,
Yeah.
What do you really need help with,
You need to be able to follow through. You can't say, I'm going to help you with this, and then, I've had people say, like, oh, I can take you to your appointment, but then they leave me, like, anxious about, are they actually going to take me? Like, I can't relax about it because come the day of the appointment, I don't know if they actually are going to take me. But, like, last night, one of my friends, she was over here, and then we were FaceTiming with another friend, and they were just, like, they were working out, who was going to take me what time, and, like, it's just so helpful not to think about that. And I trust them. I trust they're going to be there, and, so that kind of thing is helpful. But when someone says they're going to help you and then doesn't, it just adds that much.
That actually drove me nuts. That actually pissed me off, like, to the point of no end, because I would get the old, let me know what I can do to help.
Yeah.
I'm never going to let you know because for so many reasons. But Tom got to the point that it would annoy him, and people would say to him, what can I do to help you? And Tom would be like, you could take the kids to Disney.
Right.
And he would say it so stone-faced, and they just would look at him like, that's not what I meant. But what else was helpful was paper products. I know that seems so stupid, but like toilet paper and tissues and paper towels, because we ran out of that shit constantly because Dopey never remembered to get that at the store. He'd go to the store and bring home dog bones, and then I'd be like, there's no toilet paper.
Well, one thing I want to say this before I forget my thought, because I know it's going to happen. But one thing that people should do if they really want to help, and I'm forgetting my thought. Wait, come back. It went into the light.
You're not an angel anymore.
Aww.
Still raised though.
Damn it. Emo brain.
Yeah.
Oh, okay. It's. I don't know if this was the thought, but here's a thought. But if you are helping someone and you can follow through, don't tell them what an inconvenience it is. Don't be like if someone asks you, like if you ask someone to, give you a ride somewhere, where'd you go?
I don't know.
All right. If you ask someone to give you a ride somewhere, and or if you're a caregiver or if you're a friend and someone asks you to give them a ride to their appointment or something, say yes or no. Don't say, well, I could if I, go in late to work, and if I find someone to pick up my kids, and if don't tell me all the things that I'm doing to inconvenience you. Just tell me you can or you can't.
What the heck was that?
I took a picture.
People actually told you it was inconvenient because, like, how obnoxious
that is the rudest thing I've ever heard in my life.
I've had a couple of people where they said, let me know if there's anything I could do, and then they're at the bottom of the list. Like after I go through everyone else, like if I need to ride somewhere, and I'll contact them, and they'll be like, well, yeah, I think I can, but I'm not sure because I have to do this and I have to do that and I have to do this, and I'm stubborn, and
oh right.
And it's just like I know it's an inconvenience. It's an inconvenience for everyone around. But when you actually tell me, and my mom does this, she'll always, because she has to take a day off of work, and even though I tell her she doesn't have to because I could find someone else to take me, but she wants to be there, like she'll say, because she just started a new job, she'll say, I had to take an unpaid day off of work to come here, and I'm just like, don't tell me that. I know it, and
Give me your mom's phone number.
Yeah, please. I want her to talk to me because my mom always complained to me. Like, I was the one that if something happened, like, she would complain to. And I think she doesn't understand that, like, that's not okay anymore because
Right.
all this other stuff going on.
Right.
No.
Especially when she's complaining about me.
If Seporah was Italian, she would, like, the way she's talking with her hands. And,
We gesture. Pasta fazool.
I think one of the things that people can really, a good piece of advice is that a lot of times, the beginning is where we're overwhelmed and everybody is giving you everything. But as time goes by,
People fall away.
Dwindle and people go away and people aren't there for you as much. And, so if somebody's wondering what they can do, it's to stick around, like it doesn't, after your wounds have healed, doesn't necessarily mean that you're better, that you
still need something.
Yeah, you still need help in a lot of ways, and it might not be physical help. Sometimes it might just be listening or checking in. I think that's some of the best help I've ever had was just somebody checking in on me.
Yeah,
did your non-cancer friends check in, though, or were they cancer friends?
I would say, honestly, when this all happened, people arrived that I didn't anticipate arriving, and people faded into the mist who I thought for sure would be there for me.
Isn't that a thing?
So people that were there for me at the beginning are the ones that aren't here now. And I don't know if it's because, like, the novelty wore off. Like, they were so, like, gung-ho about everything. They were like, yeah, we're going to do this. And then
the novelty of cancer, the gift of cancer wore off.
It didn't keep on giving for them.
True. That part is true. My husband always used to say, all the people in my neighborhood came out of the woodwork. He's like, how come you're so popular now? How come everyone, you're like little Miss Popular in the neighborhood? But it's like, when I had no hair, that's when everybody wanted to walk with me and do all this stuff. And it's like, now, oh, she's better. It's like, where'd they go?
Yeah,
Anybody ever check on me?
I have people that, like, I won't hear from for months, and then, like, I'll post something on Facebook, and then all of a sudden be like, oh, I've been thinking about you nonstop. I keep wanting to get in touch with you. I'm like, well, then why haven't you?
Yeah,
that's what I say to you.
You're actually not thinking about me, and the only reason you're thinking about me now is because there's a post right in front of you with my name on it. So don't, bullshit me.
Yeah, I lost a lot of friends. I'm not going to lie.
Mm-hmm.
I didn't have any cancer friends, Marie, until now. So the non-cancer friends are the ones that never, it's like, just in that acute phase, and then they never, like, check up on you afterward. Like, how are you doing? How are you doing?
They don't understand. I just think they don't understand. And I didn't have any cancer friends at the time that I was diagnosed, so that was an evolution for me to find friends who knew what I was going through, and that was, I guess, a gift, to find people who I could connect with and knew what I was going through.
That's the only gift right there.
Right.
That is.
But people definitely go away.
It's one thing I always say, though, and this is one thing that I always battle with, because I love my girls. I mean, Lisa, you and I talk on a regular basis, and I definitely talk to Seporah way too much. I just brought that bitch to my basement.
We've gone places that
We've gone places that nobody should ever go with a friend. But, like, I think about the fact how we got here, and I got here from cancer, and I fucking hate that. Like, I really, really hate that, because I don't want to ever, like, if I could go back, I would love to get rid of cancer, but I don't want to get rid of my friends.
I know.
It's the weirdest feeling.
It is fair. The one thing, the woman that I said that would post the blog about how happy she was all the time, best patient in the world, her family sent out a very specific, detailed list of, because she was eating, like, very specific foods, and so at first I thought, God, they're asking for, like, only organic foods, and, really expensive stuff, but at the same time I was like, oh wow, this is actually a really good idea because this is really what they want, and there's literally specifically saying, if you want to help, this is what you can do.
Yeah, when I was, especially when I was first diagnosed, people, when they would bring me food, they would bring me cakes and cookies and all the stuff that I didn't want that were making me sick.
Yeah.
And like, if you want to bring something, then ask me. Say like, what do you feel like having tonight? Can I go pick something up for you? You know, and
I'll be honest with you, that was the hardest thing for me because I love to cook, and having to have people bring me food was really difficult, like eating other people's food. And my kids are all food snobs, so they would look on the calendar and be like, who's, Lucy Lou, why is she bringing me food? And what is she cooking? Like, they were like freaking out about it. And I'll never forget, for the most part, we had great meals. People brought us delicious things, but this one meal came, and I was having a really bad day. I was still really sore, and I couldn't cut celery. And I had already thrown the knife, and I was pissed off that I couldn't cut frickin' celery. Like, I just wanted to eat celery, and I couldn't cut it. And I was so mad. And I'd already been pissy.
Why don't you stick the whole stalk in your mouth?
It was the whole thing. You know what I mean? Like, I couldn't.
Stick the stalk.
Anyway.
I make everything so difficult, AnneMarie.
I did. So this meal comes. First of all, it was banana ice cream, which, like, banana, like, ew. And then we lifted the lid off of the container, and it was supposed to be like vegetarian sloppy Joe. It was the smell of it was unbelievable. Tom tried to eat it. I started crying. I was like, I can't even cook my family dinner. I was like wigging out beyond words. And then another friend came over, just by happen to come over to bring dinner. So sweet. And she brings pasta, which smelled glorious, and it had all ground beef in it. It was like we ate waffles that night for dinner. But
Wait, you don't eat meat, right?
No, I don't eat meat, and the only one who eats meat
Did they not
is
know
Tom.
that? Did they not know that you don't eat meat?
Clearly they did not know.
Right?
I think they were just being nice and just like bringing some food, but
Maybe they thought that now that you have cancer, you'll eat meat because maybe meat will cure cancer.
I don't know.
Well, we all know that meat doesn't, Seporah.
I'm sure you too. I was making a joke.
When you guys were, after your surgeries, especially the initial ones, like Lisa and AnneMarie, were your husbands able to be home with you for a while, and then did they have to return to work, and were you left kind of on your own? Like, what kind of support did you have?
My husband, it's so weird, it must have just been meant to be because he was in private practice where he probably could have never been around for me, but then he started working for the government, and he had this incredible boss who just let him work from home as long as he wanted.
That's
So
awesome.
he was there.
Oh my
So he
God,
was
Lisa, that is awesome.
Alone.
It was he was there all the time. Thank God, because his family sucked majorly, so that worked out well as far as that was concerned.
What about you, AnneMarie?
What was the question? I bleeped out for a minute. I don't know what the hell happened.
Like after your first surgery, was Tom able to stay home with you for a while, or did he have to go back to work? And
No, my surgery was in the summer, and he's a school teacher, so he was up my ass like a hemorrhoid.
yeah, I had a couple of days. My parents flew in. That was helpful. My husband was home for a few days, and after that, like Seporah was saying, people who say they're going to be there for you and help you, there were people in my life that said that, and then they were nowhere to be found. And I was literally like a week after surgery alone at home, having to figure out how do I take a shower and how do I put my clothes on and take them off. And,
Yeah.
I mean, literally sitting on the toilet was a feat.
Yeah.
And getting up and pulling your clothes back on was terrible.
What surgery did you have?
I had the bilateral and with reconstruction. So I had the expanders in, and I can't even. I mean, is that what you had?
At first I had a bilateral. I know, laugh, right, AnneMarie?
Yeah.
I had bilateral mastectomy, and then I had an expander put in the side that I had the cancer on, and then on the other side I donated my own tissue. Like, so it was not the deep like AnneMarie had, but it was from my butt.
Right.
I had drained.
She's got a butt boob.
I do have a butt boob. I totally have a butt boob.
I got a belly boob.
And I saw AnneMarie's scars the other day, and I got to tell you, AnneMarie, it really makes me think twice about whether or not I want to have that surgery.
Is that from the knee surgery, AnneMarie?
Yes. Yes. Lisa and I got naked together the other day.
We got naked. I swear to God, the whole day, AnneMarie, I was laughing when I was driving down Onondaga Parkway. I'm like, look how beautiful we could be wrapped in a blanket with our naked foobs.
You know, there's a major misconception. If the four of us were to take our shirts off right now,
Yeah.
Oh. Mm-hmm.
Totally different.
As to what you see when a woman has breast cancer, there's a huge misconception. If people think you have breast cancer, you have your breast removed, you have reconstruction, and it's all taken care of. Boom, you're done. Bye-bye. See you later.
Yeah, no.
Yeah, and
That is
you've
not
got great
the case.
boobs.
Melissa, I've never had the pleasure to see your breasts. I've
You
seen
will.
the other girls' breasts in this room, so I know for a fact that they're not perfect little porn star breasts.
Yeah.
You know, I wanted people to see.
You have implants, Melissa?
Yeah, it's been a year. October 30th was 1 year since my implants were put in, and I hate them. I mean, I'm living with them, but I hate them.
More often than not, I hear people talk about how much they hate their implants. These things that everyone thinks, oh my God, you're so lucky to get implants, and most women just don't like them.
No, there are days and hours in the day where I have such discomfort and irritation that I physically want to, like, just take them in my hands and claw them off my chest. It's so uncomfortable.
Like, open it up and like.
I have a theory. What would you say, Seporah?
I think you wish you could like open your boob up and like take them out when you want.
Yeah.
Yeah.
And I can't describe where the pain is. It's just everywhere.
I have a theory about that. I think part of our problem is that psychologically we didn't ask for this.
We didn't want them.
We didn't want them. People who wanted a breast augmentation, they wanted that. They sought it out. They went for it. That was something that they wanted. We didn't ask for this. So I think our mind was not ready for what our body was going to have happen. And I think that's why we are so uncomfortable in it. I truly, truly believe that. And Lisa and I discussed this the other day, the feeling that we're rushed way too far into this. You're shoved into reconstruction, you're shoved into all of this, and it's too fast, it's too quick, and
part of it is our own doing because we want to be done.
It's totally our own doing.
Yeah.
I believe that we have the right to say to these doctors, wait a minute, I don't want to have that done right now. What the hell are you, I don't need to have that done.
But I didn't. I wanted it done. I wanted it to be over.
Well, and sometimes you don't know that until after. You don't know that you wish you would have waited or slowed down. And we don't know to say, wait a minute, I might not like that, because you just don't know the outcome.
That's what I tell every single person that's going through this.
I tell every single person this too. I wrote an entire blog post about it.
Wait.
The blog post I wrote where I literally showed what my breasts went from start to finish, so many people emailed me afterwards and was like, I'm waiting to do reconstruction. Thank you for posting that. Like, they were floored by it. Because I think people need to see that. When you see what your body goes through, it's too much. We're human beings. We're not machines. They're not meant to be overhauled like that.
But also, your mind is in such a different place at the time of diagnosis and treatment. You're just thinking, get it out of me, get it done. You're just in a different place than you are for the ever after part of it.
Yeah.
Right. You're so right. I think fear drives us intensely in the beginning, and it misguides us a lot of the time.
And you have too much information. Like, you're too overwhelmed with all the decisions you have to make. You know, I would, you can never, ever, ever make a mistake by waiting. Ever.
I agree.
You can only
I've
make
heard
a
of women
mistake.
getting diagnosed one week, and the next week they're like in surgery having a double mastectomy. It took me 2 months, which I thought was like a really long time at the time. I kept thinking, why are you guys waiting? Why are you taking so long? You know, exactly what Lisa said, I want this out of me. But I think that looking back in hindsight, I probably got a better deal than somebody who got rushed in a 7-day period.
But I waited 2 months also, Melissa, and I thought I researched everything and made the best decision, and my reconstruction failed.
It did.
Yeah. Yep.
You're near me, Lisa. Do you know that?
Where are you?
I'm in Northern Virginia.
You are. Where in Northern Virginia?
I'm in Manassas. I'm about 30 minutes west of D.C.
Road trip.
I know.
What did you say?
Road trip.
Road trip.
I love
You're very close to me.
Yeah.
All right, we have to wrap it up because we started early so that we could. You got to get your kid off the bus. She's got to walk a dog. I got a speech to give to freaking 500 Cornell students.
700.
Today?
Don't say that. Don't scare me more than I already.
Go.
I know. I wanted to go too, but I couldn't.
I always wanted to go to Cornell. It's my one chance at going to Cornell.
You're going to be with AnneMarie, right? The other AnneMarie?
She never got back to me. The douchebag.
I was supposed to go too, maybe, but now I can't go.
No, you got more important
I
things.
got this
tomorrow.
cancer.
Oh, Bob! Bob!
What? Oh my God, Bob!
How you doing?
You!
I feel lousy.
Aw.
Oh, Bob! We love you so.
I know.
Are you
managed to
getting
get a
good
urinary-
drugs?
What now?
You have good drugs?
Yeah, I do.
That's good, at least, right? Are you in pain?
Yeah, well, I just wanted to say hi to you folks. I miss you guys.
We've been talking about you, thinking about you, hoping you were, okay.
Yeah. Well, I got a urinary tract infection, so
Oh, God.
I'm feeling miserable.
How did the surgery go?
Surgery went okay. The what do you call it? I can't even think. The nerve block didn't take effect.
Oh, great.
Oh, my God.
So,
Seriously?
yeah, so it took partial effect. So,
Oh, Bob.
but
You
anyway,
felt
go ahead
something?
and talk. Go ahead.
No, we're just about to finish.
We were just going to finish, so we're glad we saw you.
We started at 1 today.
Oh, that's right. I forgot about that.
Yeah. I'm so glad to see your beautiful face.
Thanks.
All right, when do you think you'll go home?
I'm supposed to be discharged tomorrow to the to Apple
Rehab?
Rehab, which is the local rehab facility. It was only like 7 minutes from home.
Okay.
It was really nice.
Oh, good.
Yeah.
Any cute nurses?
Not really.
There's that smile.
You should have Tony come in dressed up like a nurse.
Yeah, have Tony come in dressed up like a nurse.
There you go.
Well, we love you. We've been thinking about you so much.
Well, thank you. I appreciate that.
Yeah, feel better.
Feel better.
I'll try to join you guys next week if I can.
Yeah.
So you're keep it at 1 o'clock?
Yeah, I think that
1
works
o'clock.
better, right? 1.
Yeah. 1.
Yes.
All right.
Well, get some rest and feel better.
I will. Thanks so much.
Get rid of that urinary tract infection.
Drink cranberry juice. And
I
stay
know.
away from sugar. It causes cancer.
Cranberry juice in your IV.
Right.
And just think positively and it'll go away.
I know. Well, that's what I was thinking when I first, had it. I said, oh, my God, it's probably the cancer.
Oh, sweetheart. Look at your wristband is pink.
What?
What's that now?
That's a limb alert?
That's a lymphedema alert.
Yeah.
I know,
Oh.
but it's pink.
It's red.
It's pink.
On mine, it's red.
Let me see your wristband. What color's your wristband?
My wristband?
Is it pink?
This wristband?
It's
Pink.
It's pink.
It looks red to me.
You're drunk. Bye, Bob. We love you.
Love you too. Take care, okay?
All
Glad I
right,
caught
girls and boy.
you. All right, we'll
Till
talk to you
next
next week, okay?
Oh, look at the doggy. The doggy's
Oh, the doggy. Oh.
I just got a hamster.
Oh, Seporah got a hamster. Let's welcome
I
two
saw
weeks
I got a hamster.
You got a hamster?
Yeah, my mom and I stopped at the pet store on the way home, and she got me a hamster because I was good at the doctor.
Yeah.
See, apparently if you have cancer, you get whatever you want.
I do. I get a hamster for my cancer.
He plays that cancer card way too much.
The hamster card. Oh, it's
Take
licking
the rest of it
you.
away. All right, kids. I'm shutting us off.
All right, this
See you
is
later.
Your address.
I don't always forget. I sent it to you.
Never. Liar. Never.
Yeah, your pants are always on fire.
Wait, I don't know how to shut it off.
What the hell's DM?
direct message.
Direct message, you dumb butt.
On what?
Just send it right there.